The woman's reproductive system is in a conducive situation or conducive environment to accommodate pregnancy. Usually, the male infertility is not that of a problem because, for example, the most common things that may be associated with male infertility will be sperm issues. One,
Low sperm count.
we may have low sperm count. Two, we may have teratospermia. Teratospermia means that the sperm is there, but the morphology has changed.
Okay.
Each sperm has a head, a midpoint, and a tail. So if there is any changes in the structure, be it the head, be it the midpoint, be it the tail, that is teratospermia. Or someone may be producing enough sperms, but their motility is not there. They can't swim. So Astenozoospermia, they can't swim. That one too is a problem. Some may also have dry orgasm, something we call dry orgasm. Like they will have the orgasm, but they can't ejaculate. So aspermia. So they can't produce the sperm. So they'll have the orgasm, nothing will come out. We call it dry orgasm. And some people may have,
Oh, wow.
yes, yes,
Is it rare or is it
it's
common?
rare.
Uh-huh.
Aspermia is rare. The most common one is the low sperm count that you
And how much does it cost to treat low sperm count?
For that one too, yes, since you have to go through a series of labs, taking medications, it's quite expensive. We will take it between the ranges of 2,000 to 500 cedis per the diagnostics and the therapeutic part.
2,000, between
5,000
2,000 to
to
2,000.
5,000 cedis.
5,000.
Yes. So for the diagnostic and the therapeutic part. So let's say you come to the consulting room, we take a history. So usually the labs you request will depend on the history we take. So if you take the history from the male side, history from the female side, usually we advise that they come together, the husband and the wife. So you will take the history from both. From the history, you may find out who is the cause of the infertility or who is at the side of causing the infertility. Then you will think about the labs that you request. So if it's in the line of the man, request for the sperm analysis. Requesting for the sperm analysis, it may cost about 500 cedis, from 300 to 500 cedis for the sperm analysis. Then when it comes out and it proves that it's a low sperm count, that is when the therapeutic thing comes in. So we will give medications to help with the production of sperms. If it doesn't work, then it means that we have to go in and take the sperm, those few sperms that are left, then merge it with an egg.
Okay.
So it means that we are doing, yes, or we are doing insemination. So we will pick the sperm, get the egg, put them together. If they form an embryo, then we will implant it in the woman. Do you get it? It means that we've tried medical and it's not working. We are not getting enough sperms. Then we have to intervene. You get it?
So low sperm count actually means that there is small amount of sperm being produced.
Yes, you produce, you have a lot, you ejaculate a lot. Like at a go, after having sex, you ejaculate a lot. But in the semen, you don't have enough sperms.
Oh.
You get it? The fact that you've ejaculated doesn't mean that you've produced a lot of sperms.
Okay.
The sperm swims in the semen, so you may produce a lot of semen. But when we go microscopically, we realize that there are very few sperms
Wow.
in the semen.
And what are the causes of low sperm count?
It can be dietary issues. It can be the use of medications. For example, people who undergo chemotherapy due to the toxic nature of the chemo medications.
For cancer?
Yes, they may have low sperm count. People who were living in areas like industrial areas where they were using a lot of chemicals. Inhalation of these chemicals for a long period of time can also cause low sperm
Hey,
count.
so what are those work the minus?
It's also a risk factor.
Ooh.
It's also a risk factor. And moreover, if the person had a history of mumps, how do I call mumps in our local dialect? The what do you call jimrikutu or something? There's a swelling at the jaw. That mumps can also affect the testicles. So we have mumps or chitis. If you've had that in the past, you may be at a risk of having low sperm count. And if you have any testicular infection, testicular cancer, all these things may lead to having low sperm count. So men are also having issues, not only women.
Not only women.
Yeah.
Not only women. I would be interested to know that some men have these issues and then they'll be mounting pressure on the women.
But that one,
Blaming them
that's
solely.
right.
Blaming them solely for the cause. So, well, I want to find out from you. Averagely, on an average, how much would a woman or a couple need to spend to treat fertility case? Let's say you diagnose that you have this issue. How much on the average? Or in other words, what's the highest amount a couple will need to pay to treat their infertility case for a child?